If you have a pulled muscle, a hamstring strain, a calf strain, or an avulsion, then this video is going to be really detailed on exactly what the anatomy is and how that injury impacts you. So we're going to dive into how you can heal it on your own at home. Let's get into the video. Pulled muscles, muscle strains, and muscle tears, they're all the same thing. We're actually losing the integrity of our fibers and they're not connecting together. So we just have a tear in that muscle. If we have a torn hamstring, we're actually going to have a tear, a separation in this tissue right here. Same thing in the calf. We're going to have a tear in the tissue. So when we're thinking about this in the hip flexor, we can have a tear here in the hip flexor, our rectus femoris, here our TFL, and also here our psoas major coming down. So any one of those areas we can have a hip flexor strain. An avulsion is actually the bone ripping off. So the hip flexor is attached right here. This is our sartorius. The hip flexor is attached right here on the bone, and an avulsion would be where the muscle pull or a tendon pull, but right here it would be a muscle pull, is pulling bone off of that part of the pelvis, and that would be an avulsion fracture. So we've got to decrease that tension on the bone. That's what's really important. So decreasing the tension on the bone right there, but then also decreasing the tension on a muscle so that we don't continue to get that pull. When we're thinking about muscle tears, muscle pulls, and strains, think about it like your pants. If I have muscle that's bound up right here, my muscle's really tight and it's pulling on my pants like this, and I have a tear up here, if I continue to have this pull right here, then the tear is never going to heal. And then we get into a conversation about stretching it. And in the first 2 weeks, a lot of people want you to stretch that area. If we're stretching it, it's not helping us. We've got to get that tension off of it. So we actually have to break up the tissue. We have to loosen up down here and let it cinch up so our body can heal that area. We're going to lay down scar tissue, and scar tissue is good in this area. In the first 2 weeks, we want to lay down scar tissue so that the tissue heals, and then we can start stretching it out later on. We'll talk about that further in the video. Comment to let us know what muscles you think you might have torn. We probably have some specific things that you should be doing to help heal that. Let us know in the comments so that we can help you out. We have to establish tissue healing time. So tissues, when we tear a tissue, it takes 2 weeks to get 50% healing. And this is across the board. When we get to 6 weeks, we get 80% healing. When we get to 12 weeks, we get to 100%. So a lot of times at 6 weeks, our clients don't have pain. So what we want to do is get to that 12 weeks, but we have to change the things that we're doing and the interventions that we have to make sure that we continue through that healing process and we make sure it doesn't come back. A big thing is about getting out of pain, but we also have to make sure that it doesn't come back. We don't want to re-tear. So many times I have a client that came in, he had 2 hamstring tears on one side and 2 hamstring tears on the other side. He was a football player, and we had to work on why he was having those hamstring tears, because he was using muscles improperly, and he had been to 5 other places before, but they never got him firing the correct muscles to redistribute that stress, and they were going too fast to try to stretch out that muscle tissue. So we changed the way that we did our interventions, and for the first 2 weeks, we were really focused on loosening up that muscle tissue and staying away from the area that was torn because we needed it to cinch up. And then after 2 weeks, we start actually getting into the area that has scar tissue in it. And we start breaking up that scar tissue about 5 to 10% at a time. But then we're getting into stretching, but we always do it in a sequence with blood flow. It's always important with a muscle tear to increase blood flow while we're trying to heal, but we can't get to a point where it's causing irritation to where you have the tear. So we want to be doing cardio, we want to be doing it consistently to increase blood flow, but we shouldn't be taking the tissue length. I shouldn't be lengthening. If I had a tear in my bicep, I don't want to lengthen it out all the way. I want to get blood flow through a shorter range of motion and make sure that it's healing through that. With blood flow, we get more oxygen and we get more healing. So we're always going to sequence things. We're going to want to break up tissue, loosen up the adhesions where we have bound up tissue. We want to loosen up scar tissue where it's broken down after the first 2 weeks. And then we want to get blood flow consistently. And then we can lengthen it. Low load, long duration is what's going to get us tissue change. So we want to be doing that consistently, but we always want to sequence it with breaking it down, increasing blood flow, and then lengthening it. So really important, the first 2 weeks, we're staying away from the area where we have the tear. The best way to look at it in this video is from the bicep. If I have a tear right here in my bicep, I'm gonna loosen up this tissue below it. I'm gonna loosen up the tissue above it. I'm gonna let that cinch up and scar down. And then after 2 weeks, I can start getting into the area of the tear. And then once we get to 6 weeks, then we can really start getting into the area of the tear. But during week 3 to week 6, we're going to be getting a lot of blood flow and we're going to be lengthening out. And then at week 6, we're going to start going into our program with as much intensity as we can, but we don't want to be having issues where we get tightness after we've done our activity. So a lot of times people will come in and they talk about having a hamstring strain, a calf strain, and what's happening is they'll have pain when they're doing activity. And so that's the first degree. If we're having pain with activity, then we have big problems. We're not doing the right stuff. We're pushing it too hard. Once we get to a point where we're not having pain with the activity, we're measuring, are we having tightness after the activity? And that's what our clients report when they have a muscle strain. Same thing with me. I've had a bicep strain. After we do our workout, it feels really tight in a certain area. That's the second degree. We should get to a point you may feel tight the next day. That's called DOMS, delayed onset muscle soreness. That's okay. And we can push through to have a little bit of DOMS the next day, but we shouldn't be having tightness right after our activity, and we definitely shouldn't be having irritation while we're doing our activity. To get a full resolution after we have muscle tears, we have to get back to doing whatever activity we were doing before. So when I was playing football and I hurt my back, it took about a year to find somebody who was really good to help me out. And when he fixed me, he said, you're 90% better. You have 10% left. That 10% is your body remembering the pain. You need to go back to playing football. And at the time I was scared, I was nervous. I didn't want to do it because I didn't want to get hurt again. But it wasn't until I started playing football again, about 5 days into 2-a-days, that I realized, hey, my back doesn't hurt anymore. So we have got to get back to doing that highest level activity, and that's the only way we're gonna get that full resolution. So we wanna gradually increase. So if you're a runner, we wanna get back up to doing half a mile walk runs, a mile walk runs, a mile straight, and then we go up to 2 miles. That should be over a 6-week period that we're reintroducing our exercise. We can do another video exactly how we reintroduce running to our clients, but you've got to be thinking about our tissue healing times and then staying under that barrier where we're pushing up our functional capacity. Really important for this video is to make sure that you're remembering tissue healing time. So first 2 weeks is 50%. At 6 weeks, we're getting 80%. And at 12 weeks, we're getting 100%. So don't rush your body. Allow blood flow to happen. Be consistent with it. Do it good with your diet. Make sure you're drinking enough water and be consistent with that. And it's always going to heal because we have really good blood flow to our muscles. So when we have a muscle tear, it's actually a gift because we don't have an issue with a ligament. Inside our joints, we have ligaments, but then tendons are just the muscle attachments to the bone. And we have right on the tendon, we have less blood flow. In the muscle belly, when you get a muscle tear right in the muscle belly, that's the best thing that's going to heal. We just have to remember the first 2 weeks, we don't want to push it too hard. And if you do that consistently, then you're going to heal good and you're going to be able to break down. If you feel a knot inside a muscle in your hamstring and your calf, those knots, you have to break them down over time. But remember, you have 12 weeks to get that, so we don't have to push it too hard. Make sure you subscribe to the channel, hit the bell notification. You don't want to miss out on these videos. We want to make sure that you're consistently getting better, and check out our other videos here on the channel because all of this stuff is geared towards you and the things that we see here in the clinic that people are having problems with. See you in the next video. Get mobile and stay active.